Before we move on to hear from Nate, I'd like to formally introduce a couple of men who played a pivotal role in diagnosing and treating Nate and his cancer. First is Dr. Tom Kinney. Dr. Kinney is the medical oncologist and hematologist, and he practices at both Porter Adventist and Parker Adventist hospitals. With a degree from the University of Maryland School of Medicine, Dr. Kinney later fellowship trained here in Colorado in hematology and oncology. Right here at our Health Sciences Center in 2001 through 2004. So we got him home and we got him where we need him, right here. He's the past president of the Rocky Mountain Oncology Society, as well as a member of the Colorado Medical Society, the American Society of Hematology, and the American Society of Clinical Oncology. It's my pleasure to introduce to you Dr. Tom Kinney.
Well, thanks for having me here today. This is just a pretty amazing experience being up here and just looking at this list really just brings it all home. You know, we are somewhat isolated from things in the hospital, and we see blood products and come down the line, and you know, it really is very, very cool to be informal, to be here and really see how all of this starts. And you know, just right off the bat, wanted to thank you guys so much for your donation and your dedication. I think it's just really neat that you're here. Well, I guess I'm not going to go into a huge detail. I asked Nate how much he wanted me to talk about up here today, but we met about a little over a year ago, and Nate was pretty sick when he first came in, but being the unbelievably tough young buck that he actually is, he had endured a lot of difficult symptoms for a while by the time he came in, and as was alluded to earlier, he does actually have a form of testicular cancer, or had, let me rephrase that, form of testicular cancer that most of the time starts in the testicle, but in his case really was just in the abdominal cavity. And this cancer was quite massive when he hit the door of the hospital, and there actually was also evidence of disease in the liver and the lung. So the situation looked pretty dire, actually, in some ways when he came in. It was a very serious case. Thankfully, the type of testicular cancer that he has, and I'm still sort of calling it that because that's sort of what it looks like under the microscope, is very sensitive to chemotherapy. And with some fairly heroic efforts, we were able to get in all 4 planned rounds of his chemotherapy, which I believe was a pretty important thing to try to cure him of the disease. We've been following him over the last year, almost, since he's finished the treatment with examinations and special lab tests and CAT scans, and have seen no evidence at all of the cancer returning. And in most cases, the cancer would have reared its head by now if it was destined to come back. So we were hoping and expecting that he's going to be a cure, or already is cured from his cancer. The speed bumps, a few of which have came up along the way that involved the blood, was that this cancer was badly intertwined with his major blood vessels in the back of the abdomen. And as we started giving him chemotherapy and the cancer started shrinking down dramatically, it actually eroded into the aorta, which is the major blood vessel which carries blood from the heart to the rest of the body. And we had 2 very critical episodes that came up where there was extreme bleeding from the aorta, and that's when we used the majority of the blood donations from you guys, and it truly, I mean, it saved his life. So it was, sorry, I'm getting a little choked up. It was very cool. And the guy who saved his life is standing right there. It's Dr. Yee. So I'm going to bring him to the side.
Well, let me give Dr. Yee a better introduction, I guess, if you will. Dr. Yee is Nate's interventional radiologist, and he's a physician with Inglewood-based Radiology Imaging Associates, and he aids patients now in 7 hospitals here in Colorado, including Porter Adventist. He earned his medical degree from the University of Colorado School of Medicine, but enrolled in the interventional radiology program back at the University of Pennsylvania, and then we had to figure out how to get him back into Colorado, I guess. Dr. Yee is here to talk some more specifics on Nate's care. Dr. Yee?
Thank you. I'm probably maybe one of the few natives actually sitting in the room. I was born and raised in Denver, Colorado. So I came back home. So I spent my time traveling around, and I'm glad to be back home. I know I have been given the honor of being told that I saved Nate's life, but I don't feel like I saved his life. I feel like I played an important role in keeping him here on this earth. He had a pretty serious problem. I've been practicing medicine for 17 years, and I've never seen a problem as severe as his in my entire life. His initial bleeding episode was basically because he had a hole in the major blood vessel called the aorta. And this hole, normally if we didn't have other problems in our abdomen, sometimes would be contained and you could bleed into your abdomen, and eventually you would bleed enough into your abdomen and the pressure would basically fill up and the bleeding might stop. Unfortunately, in Nate's case, his hole communicated with his intestinal tract, and so the blood was actually pouring out of his mouth at the time when he became so ill. And we were fortunate enough in interventional radiology that we have these special devices that we can actually put in through puncture sites in the groin, not necessarily cutting the abdomen open, because he wasn't really a surgical candidate because there was so much tumor in his abdomen. Being able to go in and potentially try to plug up the hole by cutting down on it really wasn't an option, especially at the rate of bleeding he was having. And so we were fortunate enough during the first procedure to put in a special device called a stent graft that allowed us to sort of reconstruct his aorta from the inside. You know, as great as and as expensive as our technology is in interventional radiology, if it hadn't been for the people who are sitting here in the front row, if it hadn't been for your most gracious gift, it wouldn't matter what I could do. Because if it hadn't been for you to be able to give him life's blood, it doesn't matter what hole I would be able to plug up because there wouldn't have been enough blood to keep him alive. And so your contribution is much greater, in my mind, than anything I could ever do. So I really appreciate the ability to get up here and give thanks to the people that make it possible for me to do my job. Thank you.
Thank you, Dr. Yee.